is Memalari community, a village situated in a typical arid environment. Plying the road leading to the village is not an easy ride due to the sandy nature of the terrain. Memalari is located in Yusufari local government area of Yobe State. For years, residents in this community have had to trek a long distance in search of medical help. The only option they had to accessing healthcare services was to walk to neighboring communities with the hope to using their healthcare facilities. Not because there were no structures nor medical kits in Memalari, but because the medical facility they had was outdated. Ajila Memalari is a native of this community. She says before now, many people have lost their lives due to the lack of a healthcare facility. More so, accessing healthcare in other community has been difficult because of the bad roads. This is a picture of what the healthcare facility in Memalari village looked like. Now, a new structure is being constructed to replace the demolished male and female wards. Rehabilitation work is in progress.
Before initially, our hospital is only shallow. The hospital is no more hospital. With the coming of this 71 million life, the hospital was built and the hospital was equipped, and we got a provision of ambulance which is carrying our pregnant women from our rural community down here to Memalari facility.
Like you have been seeing here, it is in my female ward there we are reconstructing, and this our pharmacy will be demolished and expanded to make the male wards.
Before, the roof was leaking and the structure of the quarters was not okay, and which makes other midwives not to stay in the quarters. They were staying outside. But now the way it is, seriously, we are happy and it's comfortable for us.
For every democratic society, healthcare delivery is one of the significant cardinal points for every successful administration. This is becoming evident in the administration of Governor May Malabuni.
Yobe! Yobe!
In about 1 year and 5 months, the Yobe State Governor, May Malabuni, has not only kept his promise of continuity and consolidation, he has adopted an innovative strategy to save people and provide the essentials for those in the rural communities. Governor Buni is aware that affordable and accessible healthcare services to the people of Yobe State is not to be taken for granted. This is the reason Governor Buni decides to take advantage of the Saving 1 Million Lives project, an elaborate healthcare scheme aimed at expanding access to essential primary healthcare services for women and children across Nigeria.
Saving 1 million lives was initiated in 2016 and has been very supportive of the health system in Yobe State, which has enabled many facilities to be upgraded, renovated and equipped with drugs and other services.
1 Million Lives Program for Result is a program that was conceptualized by the federal government through a grant, through a credit facility which was given to states as grant on the condition of making improvements, in critical improvements in particular program areas. As such, the program is a state-owned program, and having won funds through the program, the state government saw the need to maximally utilize the funds and by channeling it towards coming up with interventions that will touch the lives of the people of the state.
The government under the leadership of Honorable Memala Buni honestly has is one of the key important thing that I mentioned that lead to the success of the 71 million life program, for example, in Yobe State, which other states have never got that. That's the reason. If you compare Yobe State with other states now that implemented 71 million life reserve, they haven't achieved much like the way the Yobe State government achieved because of the dedication and commitment and leadership of our Governor, His Excellency Governor Memala Buni.
One of the objectives of Saving 1 Million Lives Initiative Program for Results project is to increase the utilization and quality of high-impact reproductive, child health and nutrition interventions. In Yobe State, under the leadership of Governor May Malabuni, more than 100 primary health care centers are undergoing rehabilitation, upgrading and construction across 145 wards in the state. Most of the construction and rehabilitation projects of the healthcare centers are simultaneously ongoing at various wards across the benefiting communities in Yobe State.
Intervention by the 71 million lab program has impacted positively on our healthcare delivery, especially at the primary care level, considering the level of upgrading of PH facilities at the various LGS. Some of the works have been completed while others are ongoing. So actually it has a positive impact on primary healthcare delivery in Yobe State.
We are all living witnesses to the remarkable strides that have been recorded in terms of construction of 53 primary healthcare centers, out of which 39 have already been completed now. 14 are at advanced stages of completion. And through the instrumentality of this, also a 200-bed capacity female student hostel has been completed. Has been built at the Shausley College of Nursing and Midwifery, Damaturu. And then maternal and child health complex is also being constructed, which will be not less than half of the current structure of the teaching hostel that you are seeing. The new complex that is being built is more than half of the current structure in terms of size and bed capacity.
Tudwada Primary Health Care Quarters is almost at completion level under the construction and supervision of Saving 1 Million Lives. The healthcare facility in Potiskum Town is still undergoing serious rehabilitation and upgrading, but that does not hurt healthcare services, as temporary provision was made for healthcare workers to attend to patients.
Most of the clients don't have the money of coming to the facility to run the services on their own. But because of this program, people are trooping in the facility, both children and women.
Its pharmaceutical store is well stocked with drugs and consumables, while the laboratory is equipped with working tools to facilitating service delivery. All these are possible through the laudable support of the state government in collaboration with Saving 1 Million Lives. This is a deliberate effort by Governor Buni-led administration to provide health workers with comfortable apartments and ensure health workers are closer to the healthcare facility should emergency cases arise. In Gadaka, the primary healthcare facilities are already renovated and equipped. Standby tricycle ambulance is seen at the healthcare facility. The tricycle ambulances were recently dispatched across the 17 local government areas by Governor Buni-led administration to ease rural referral at the grassroots levels.
Actually now, our facility has improved beyond what people are expecting. Why? Because Saving 1 Million Life have bring pre-antenatal services pre-delivery services, immunization, children under 5. Sometimes they used to bring pre-drugs, pre-services here and there. People are appreciating their effort, and even they have built 2 staff quarters for our midwife. Now they have self-reliance. Always they are in the facility conducting their services without any inconveniences.
The tricycle ambulances, if you look at, has alleviated sufferings of repairing rural women, especially during pregnancy, to the nearest health facilities. So I believe we appreciate his effort and has yielded a positive impact in improving the health care of the people of Yobe State.
Even to inspire you to do what is right. You know, these funds are actually performance-based funds. We performed to earn those monies that are being channeled to further improve the system. It's like a vicious cycle of positivity. You work positively, you earn, and you inject these earnings to further improve your performance and outcomes. Now, if you don't have that leadership that will inspire you, that will motivate you and support you to give the necessary inputs that will make you even perform. For example, one of the key things is worker motivation, health workforce motivation. Yobe State is not owing anybody one kawo.
Lawan Musa Primary Healthcare Facility is located in Bade local government area, a nice befitting accommodation newly constructed for midwives, nurses and other healthcare workers at the facility. To align with the modern standard of buildings, the metallic windows were replaced with aluminum glass windows. As a means of improving the working condition of the healthcare delivery at the rural communities, Saving 1 Million Lives in collaboration with the Yobe State government alternate the old generating set with a new generating set for almost all the facilities across the state. With the massive recruitment strategy adopted by Saving 1 Million Lives, the percentage of manpower at the rural communities is waxing stronger. As Saving 1 Million Lives complement government efforts, the project is engaging a good number of doctors, midwives, and health workers to serve the people of Yobe State more efficiently and effectively.
From outset, the program basically was designed towards the vision of His Excellency in terms of strengthening the healthcare system of the state. As such, it's already a program that His Excellency has already started implementing. As such, the funds that were won were basically channeled into achieving that vision. You will note that through because of the need for sustainability, government has established additional agencies that will, of course, further enhance the ability of the system to be to sustain all the gains that are made across the health system.
Objectives to improve high impact quantity and quality, maternal, newborn and child health services, and then nutrition through maternal health services, newborn and child health services, malaria control, HIV/AIDS, immunization, and then nutrition. Out of which all of these programs pillars that I mentioned, they are the one directly contributing to the maternal and childhood morbidity and mortality in the country. So this one is a performance-based financing program. The loan that is being received by federal government from World Bank will be given to the states as a grant based on the performance and the improvement made according to indices that I just mentioned.
These 3 midwives, they have been very good, hardworking, and 7 million have been tracking their work, giving them all the welfare they deserve, to make sure they give you the best.
The laboratories at various primary healthcare centers in Yobe State are well equipped with modern equipment, while high-trained and skilled lab technicians man the facilities to deliver optimally to the people at the grassroots levels. Saving 1 Million Lives building projects across the country are painted with green, white, green, a symbol of patriotism and loyalty to the country. The ceiling for each healthcare facility is designed with plaster of Paris (POP), while the former structure used to be a wooden ceiling board which can easily be engulfed by fire. Saving 1 million lives has erected extensively large perimeter fence at each primary healthcare facility across Yobe State. Some of the beneficiaries at the rural communities expressed joy for the speedy transformation of their primary healthcare centers. As a way of motivating the recruited health workers in Gaidam community, a 2-bedroom quarters has been constructed by Saving 1 Million Lives in conjunction with the state government.
Gaskiya before is really annoying. Sometimes even though rain is falling, our house will be draining. Sometimes our mattress, sometimes you'll be on night. By the time you will come back and you see that most of your things have been soaked with water. But as I speak now, the house is at roofing level. We are really happy about that.
We are lacking female technical staff. So as Saving 1 Million came, so they have employed 3 midwives for us, which are technical staff. They are assisting the maternal service, ANC, labor and delivery, family planning, and other services.
This is Bara Primary Healthcare Facility, located in Gulani local government. The healthcare center was set ablaze by Boko Haram insurgents in 2014. Now, the facility has been renovated and well equipped by Saving 1 Million Lives alongside the Yobe State government.
The arrival of this Saving 1 Million Lives staff to this facility, we are having less patient flow. But as they arrive and they start executing their services in here, we almost get like multiple or even referral from other places because of the presence of the doctor and the midwifery that the Saving 1 Million Lives sent us here.
Notice the hospital is more neater than it was before, because when I came the hospital was terribly dirty. They provide us with a lot of infrastructures in the hospital. They provided us with the stuffs we use to register our patient. That's our registration equipment, family planning models, posters, and so on. They equipped even the lab. They don't just focus on us, the midwives, they focus on anything that's going to better the hospital.
Them and for the state government to partner with Saving 1 Million Lives, it is something I would like them to sustain, because people of interior villages are now easily accessing health services, thereby making life better for them and at ease.
Bomsa Primary Healthcare Facility is not left out in the renovation and upgrading processes. Saving 1 Million Lives furnished and equipped the facility and provided adequate tools to enable health workers do their job efficiently.
They have built at least new 5 offices to the facility and then renovated the one founded here. And then after that, they even built a staff quarters. That is 2-bedroom. That is 2 flats of 2-bedroom staff quarters in the facility.
Job, because now we have staff quarters that we stay in, and as you can see, as this facility is renovated, and also there is free drugs for family planning and for pregnant women and also for under 5 children.
As part of measures to improve the sewage disposable mechanism, the state government, in conjunction with Saving 1 Million Lives, purchased a sewage disposable vehicle to avert indiscriminate disposal of waste in various government institutions across Yobe State. The Yobe State Commissioner for Health and Human Services explains why the sewage vehicle is crucial at this moment.
Saving 1 Million Lives program for result is a program that is directed at improving the quality of services and as well as the quantity of maternal neonatal child health services. The Yobe University Teaching Hospital is one of our tertiary institutions. And because of the volume of patients and the activities there, a lot of sewage is being generated. And pending when a sewage system is actually put in place, there is need to frequently evacuate and dispose of the sewage. The organization has been relying on another organization for that purpose, and that is actually very costly. And as such, they approached His Excellency, the Executive Governor of Yobe State, for his intervention. And coincidentally, the Saving 1 Million Lives program for result came in to support the state government in terms of procuring and donating this vehicle for the benefit of the system. It's not only going to be beneficial to the teaching hospital, other organizations and other institutions will also benefit from the use of this vehicle. So basically it is aimed at improving on the sanitary condition of all the institutions across the state.
As the Honorable Commissioner has pointed out, is the Yobe State University that has been helping us in evacuating our sewage. But with the procurement of this vehicle and handing over to us, inshallah, it will be a thing of the past. And as the Honorable Commissioner has also rightly pointed out, other healthcare facilities across the state as well as other institutions will also benefit from this one. Keeping your environment clean is one aspect of improving the healthcare delivery system of the people.
Honestly, I'm very much delighted, and this is not the first time Saving 1 Million Lives is donating, have been supporting the ministry and the agencies in the state. Apart from this, apart from this sewage tank, I think also the Saving 1 Million Lives is currently constructing one-story building, maternal and child health complex in the teaching hospital, and of course this one, even within this nursing college, we have another. So we have also, as you are aware, all the 17 LGS, Saving 1 Million Lives, still constructing primary health care centers, 53 currently ongoing on the projects. So these are just few dimensions. Saving 1 Million, they have a lot of projects on ground, and of course these are all the supporting the health sector across beyond since from 2016 up to date.
This is Jawa Primary Healthcare Facility. Jawa is a community under Busari local government area. The transformation of the primary healthcare facility by the Yobe State government and Saving 1 Million Lives is welcoming for residents in the community. The facility also has an additional female and male wards to accommodate more patients.
Life, we get a standard ward containing eight beds, and they renovate our staff quarters. And then at the same time they renovate our wall and they renovate our gate.
Live to the state government, we are really grateful, because one of the important things for somebody to provide the appropriate service, you have to be comfortable to give out your services well, and they have really done justice to that, and we are so grateful.
Yusufari Primary Healthcare Center is located in the southeastern part of the state. Yusufari is a local government that shares border in the north with the Republic of Niger. The healthcare services in Yusufari is not only beneficiary to residents in Yobe State, but also to some Nigerians in Republic of Niger.
I have attended to many Nigerian people, you understand, in the maternity. And if I tell them that, why are you coming to this place? Then they will try to tell me that in Hausa, Malama, because everything here, Kyautani, Koba Hakaba, that everything is free. You understand? So we have come here to receive the treatment, and we'll give them.
At the facility, nurses, pharmacists, and other essential workers are always on ground to serve the people better.
We have to say a big thank you to our Excellency, to His Excellency Memala Buni, and the Saving 1 Million Lives program, because they really save lives.
With all these innovative and progressive programs put in place by Yobe State government in partnership with Saving 1 Million Lives for results, no doubt more than 1 million lives will be saved.